viewer, you're welcome to yet another interesting edition of the program Health Matters on your favorite TV station, NTA Gombe, Jewel of Excellence. I am Shade Salau, and today on the program we shall be looking at epilepsy. And I'm being joined by my guest in the studio in the person of Dr. Kanu Alfred. He's a consultant neurologist here in the Federal Teaching Hospital, Gombe. Doctor, you're welcome to the program.
Thank you for having me.
Doctor, when we say epilepsy, what do we mean?
Epilepsy. Well, epilepsy simply means having two or more unprovoked or reflex seizures that occur that are at least 24 hours apart. So let me just go ahead and define what a seizure is, since one needs to know what a seizure is to define epilepsy. A seizure is the transient occurrence of signs or symptoms that are due to abnormal, excessive neuronal discharge within the brain. To cut the long story short, or in simple terms, a seizure occurs in a scenario of the brain cells discharging in an abnormal way, and this abnormal discharge may manifest either with things that are obvious to an observer or things that are just experienced by the victim. So it may be obvious. For instance, when you see people convulsing, that one is an obvious manifestation of a seizure. But there are instances where one can be having a seizure and a bystander or an eyewitness may not even know the person is having a seizure. So when individuals or any person keeps having seizures recurrently, as I said, the definition, at least 24 hours apart, meaning if somebody has several episodes within a day, it may not qualify for the definition of a seizure, so that at least 24 hours apart. That's one definition. Then the second definition of an epilepsy is actually when one has a single seizure but has an enduring predisposition or likelihood to developing more seizures. In that kind of situation, you can say the person also has epilepsy. So I think we'll make do with these two definitions.
Okay. Doctor, what happens to make children have seizures or epilepsy? Is it something that is detected right in the mother's womb?
Well, epilepsy or seizure disorders can actually occur across all age groups, both in children and middle-aged people, elderly persons, across all age groups. So for children, not just children, but in children there are several causes. As I said, a seizure is abnormal electrical discharge. And several things can cause it, ranging from infections right from early childhood to genetic predisposition, meaning seizures that are likely inheritable, to seizures that are related to injuries sustained during birth. So these could account for seizures in childhood. And then there is also a common cause of seizures in childhood, which we call febrile convulsions, where illnesses that can cause fever could actually make the child to just start convulsing, having a seizure. And once you treat, fever subsides, the child wouldn't have seizure anytime he doesn't have a fever. But this form of seizure actually is the form that children outgrow. Most times, once they are above 5 to 6 years, they no more experience it, febrile convulsions. But for things that cause enduring or repeated seizures are the ones I mentioned: birth-related injuries, early childhood infections like individuals with meningitis that gets complicated or encephalitis. Such infections that affect the brain cells directly could predispose in children to seizures.
Okay. Thank you so much, doctor. I was even about asking if it's hereditary, but you gave a little insight to it. Now, what is it that sends that signal to the brain to make the child behave the way he or she does during that attack? Because sometimes we hear people say, don't put spoon in the child's tongue. That maybe the child is going to bite the spoon and maybe injure his or her tongue. What do you have to say about such things like that?
Okay. Generally, for a seizure to occur, there has to be an imbalance in electrical discharges.
Okay.
Let me explain. These discharges, some we call them excitatory and then others inhibitory. The excitatory ones are somewhat positive in the sense that, let me just give an instance. An excitatory one could, for instance, make somebody move his arm or twitch his face. An inhibitory one dampens response. So when you weigh the balance, if you have excess of excitatory stimulation, that creates the milieu for a seizure. But there are causes that actually incite these things, some of which I mentioned earlier. In children, back injury. In adults, several other causes like road traffic accident, an old stroke, for instance. Drug misuse. Certain drugs are associated with seizures, for instance, tramadol. And then certain infectious processes, brain tumors, and other insults to the brain could cause seizures and subsequently epilepsy in adults. But in a child that is having seizures, actually what causes the excitation, as I said, is abnormal neuronal discharge. When there is an imbalance between excitatory impulse and inhibitory impulse, in favor of excitatory impulses, such an individual could have a seizure. Well, before I go on, seizures may not, as I said earlier, manifest with jerky movements.
Okay.
In children, there are unique forms of seizures that don't manifest with jerky movements. One of them is what we call absence seizures, for instance. In absence seizures, the child just stares, a blank stares into space and is not aware of what is going on for a few seconds and then returns to himself. So such children, what brings them to attention is when they start performing poorly in school because of the several gaps when lessons are going on in school. They stare, they return, they stare, they return. At the end of the day, they cannot make much sense out of what was taught. So what brings them to attention is when the parents or the teachers observe the child is performing poorly in school. When we now evaluate them further, we discover it's actually a seizure that is responsible, the so-called absence seizures.
Okay. Thank you, doctor, for this insight. Seizure and convulsion now, what is the physical difference?
Okay, now, seizure is what I defined earlier, abnormal electrical discharge within the brain.
Yes.
Convulsion is a motor manifestation of a seizure. Let me explain. When we say motor manifestation, means there is movement.
Okay.
Either of the limbs, the face, different parts of the body. So convulsion is something you can appreciate what you see. A seizure is what happened in the brain that led to that convulsion.
Okay.
So convulsion is just a physical or motor manifestation of a seizure. Yes.
Okay. Thank you, doctor. In your line of field, how will you rate the level of awareness when it comes to seizure or convulsion or epilepsy?
Well, because of how dramatic seizures present, particularly when they lead to convulsion, people get so scared, and it's not something people are quiet about. So there is a lot of awareness about the presence of epilepsy. Okay. But as per knowing what causes it and how to approach individuals with epilepsy, it has really been a challenge. Most people go with several myths. Some feel it's a spiritual attack. Some feel they have several perceptions, conceptions, misconceptions about epilepsy. And it has also hampered early presentation to the hospital. So most persons resort to alternative methods of taking care of such individuals, including what you mentioned, putting spoon in the mouth and all that when persons are convulsing, which we are actually we don't advocate, because most times at the onset of convulsion, the tongue has already been beaten. So the issue of forcing spoon into the mouth is not advocated, it's not advised, because you only injure the victim the more. You are not likely to prevent a bite, because convulsions, for instance, the popular one we know, we call it generalized tonic-clonic seizures. The tonic phase occurs very early at the onset, and it is during that phase that the victim bites his or her tongue. So now coming later to force in a spoon, it's not likely to be helpful. Yes, and as I said, there are several myths surrounding it. What people should know is, in most instances, there is a cause of epilepsy or a cause of seizures. Even though we have a significant percentage of individuals where you will not find a cause, but in most instances, and we have causes, and then epilepsy as a brain condition is actually treatable. Even when the cause is unknown, it is to a reasonable extent treatable and can be put under control.
Okay, thank you so much, Doctor. Does a child outgrow this? And then if it happens in an adult or in the aged, can they also outgrow it?
Well, there are different types of seizures and also different causes of a seizure. Initially, I spoke to you about febrile convulsions that occur only when children of certain age have fever. That one, they outgrow once they get to a certain age, usually above 5 to 6 years. They outgrow febrile convulsions. I also spoke to you about absence seizures that stare into space. Those ones also at teenage age and beyond that, they also outgrow absence seizures. But there are certain seizures, particularly the ones resulting from injury to the brain, either following infectious agents like a complicated meningitis, for instance, and encephalitis, a bat-related injury while the baby is negotiating the bat canal that affects the brain, or certain developmental abnormalities that we tag congenital malformations in early childhood. Such instances are not usually outgrown. Most times they continue into adulthood having repeated seizures.
Okay, thank you so much, Doctor. I just want to find out, is there anything like maybe a day set aside for epilepsy in terms of awareness, maybe awareness campaign?
Yes. There is a day set aside, but the extent of the awareness is what I cannot say much about. In our little corner on the days the day that is set aside to mark epilepsy in the World Epilepsy or International Day for Epilepsy, we set aside some time to discuss with patients, educate them about the causes of epilepsy, educate them about the availability of treatment, and also educating them about just to help dispel some of the myths
Yes.
they have regarding epilepsy, especially the matter of stigmatizing individuals with epilepsy, which is very common in our environment. Some patients or some people living with epilepsy have a bigger challenge fighting stigma than even facing the disease itself.
Yeah, thank you so much, Doctor. Epilepsy, epilepsy, epilepsy. We cannot keep on saying much about these things without having a solution. Fine, there is awareness, but can you say that the awareness has reached maybe a certain social strata of the class of the society, maybe like those in the rural areas? How do you see them responding by bringing their children to the hospital? Do they believe in so much myth, or they now have little awareness in seeing that they bring their kids to the hospital to get treated?
Well, you keep talking about kids. Seizures and epilepsy is not restricted to children. Yes, it's common in children. It's also very common in the elderly. Then it's common across all age groups. Commoner in extremes of age, children and the elderly, but any age group an individual can experience seizures, and some can go ahead to have recurrent seizures, which we call epilepsy. So in terms of awareness, the perception in most rural settings is that it is a spiritual problem. That requires spiritual solution. And on a few instances where we made attempts to interact and also interrogate such misconceptions, we were faced with very stiff opposition. So most times what we do is not to stop people from believing what they do, but rather to talk to them about an orthodox alternative to managing epilepsy. Yes, so that we don't have frictions. So we don't argue with somebody, for instance, who says it's demons that causes it. We don't go into such arguments. What we do is we let them know that it is treatable. We also educate them on identifiable causes. Yes, and occasionally we also show them people that have gotten seizures controlled and are living normal lives.
Okay. I was just about asking whether a person who has epilepsy can live a normal life, fulfill his or her goals in life.
Yes, with adequate education and caution regarding certain issues. For instance, prominent amongst which is ensuring the person takes his or her medications regularly. Epilepsy is not a condition where taking drugs erratically will sustain control. So regular medication use is very important. Then avoiding certain things. For instance, individuals with epilepsy, as much as possible, we discourage them from swimming alone. If you must swim, there must be a guide there with you. If there won't be a guide or with somebody around you, then don't swim. Why? Because it can happen while the individual is in water and the person will drown. We also discourage them driving. As much as possible, they have to be seizure-free over a specific duration or period of time, depending on what the authorities, different countries have different stipulations for they have different specifications. Some will say the person has to be seizure-free for at least a year, some 6 months. So depending on what the authorities in the country allow, the driving has to be, one has to be cautious, one has to be seizure-free for a specific duration before they are cleared to drive.
Okay.
And another thing we talk about, we advise individuals with epilepsy about is walking, climbing heights.
Okay.
Somebody with seizure disorder shouldn't start going for mountaineering, climbing a tree, just anything heights. Has to be very cautious because it can actually happen at any height, and you know the injuries that will follow.
Okay. Thank you, doctor. For one with epilepsy, do they have any special meal, special food they need to eat, or they can just eat anything?
Well, for somebody with epilepsy, they don't have any special meal.
Okay.
But if you talk of special diet for treating certain forms of seizures that are not responding well to conventional treatment, there is a diet we call the ketogenic diet.
Okay.
Yes, meant for treating certain refractory seizures that are not responding to conventional treatment. But for day-to-day, the day-to-day life of a seizure disorder patient or a patient living with epilepsy, there is no requirement for any special diet. They are to eat the normal diet other individuals take.
Okay. Doctor, on a final note, what advice do you have for people living with epilepsy as regards myths? Because we know that these myths cannot be eradicated soon. People keep saying, oh, they are witches, they are this and they are that. What advice do you have for those living with epilepsy or caregivers who take care of patients with epilepsy?
Okay, for those living with epilepsy, they have to build confidence and self-esteem in themselves. There is really nothing that distinguishes them from other people, particularly when their seizure is under good control. They can achieve their dreams and their aspirations. And for caregivers, they should not stigmatize against people living with epilepsy. It is a treatable brain condition.
Okay. I want to thank you, doctor, for coming to the studio. Thank you for sharing your thoughts and everything that you've said.
Thank you for having me.
We hope when we call you sometime again, if you're free, please, you do us well to come and share and enlighten us more again.
I'll be glad to do so.
Thank you, doctor.
Thank you.
And my guest has been Dr. Kanu Alfred. He's a consultant neurologist talking on epilepsy. He works with the Federal Teaching Hospital here in Gombe. Until we come your way same time next week, I am Shade Salau. From all of us here in NTA Gombe studio is bye for now.